Taoiseach, the RT Investigates programme into our abortion services that aired last night was harrowing. It was also infuriating because everybody in this chamber is already aware of all of the problems with these services. Your own government has been sitting on the expert report which pointed out these problems for 12 months now. Instead of action, we've had a game of political pass the parcel. The expert report kicked to the Health Committee before being kicked back to the government, where it has been since December. Last night, we saw very clearly the people who are paying the price for that inaction. Women all across the state who are traumatised, stigmatised and penalised. Taoiseach, you have previously spoken about how you came to support repeal. You said one of those reasons was a briefing you attended by the group Terminations for Medical Reasons. These are women and their partners who received a devastating diagnosis of fetal abnormality and were forced to leave the country for a termination. You said, and I quote, "I've never before left a briefing so moved by it. I was really ashamed at how these people were treated." Taoiseach, that quote is 7 years old, and despite the repeal vote, nothing has changed for these women. Irish law still forces them abroad for care because often doctors either cannot definitively say complex fetal abnormalities will lead to death within 21 days of birth as the law demands, or they interpret the law conservatively because of the threat of criminal sanction, up to 14 years of a prison sentence. The result is devastated women like Alison Gibney, forced to travel at the most traumatic time of their life, and then, heartbroken, forced to smuggle their much-loved stillborn baby back into the country, as she said, hidden underneath coats in the boot of her car. Or women like Alison Lynch and Christine Monaghan, who are forced to leave their stillborn babies in the UK and travel back without them. Taoiseach, why are we allowing this terrible suffering to continue? We're the legislators, we're the only ones with the power to change this. We have a duty to do it. You were the Health Minister when we had the repeal vote. As Taoiseach, you can take the advice of your own expert report and reform the law before more women and families experience even more trauma. Taoiseach, I want to say that I recognise the importance of operational reform and that more maternity hospitals are now providing the abortion services, but I'm asking you about something else today. In your reply, can you please specifically answer these 3 questions? Will you remove the mandatory 3-day waiting period, end the criminalisation of healthcare workers, and provide more clarity when it comes to providing abortion in cases of fetal abnormalities?
Thank you, Deputy.
Well, thanks very much, Deputy Kearns, and I will specifically answer those 3 questions, but I'm conscious that people follow these debates and discussions at home, and I do, in the time available to me, want to say a few things. I mean, the first thing is 6 years ago in this country, abortion was constitutionally banned. So a lot's changed. We had a referendum. The result was decisive. And since then, we steered legislation through this House, draft legislation that was published in advance of the referendum, so people would know if I vote yes, here's what the law looks like. We introduced it in this House, the other House, we passed it. And since then, despite a global pandemic and the very significant impact that had on the delivery of health services, we have seen the expansion and embedding of those services. So from a relatively small number of our hospitals, I think it then got up to around 12, then 17, and the Minister for Health's hope and expectation that it will get to all 19 hospitals by the end of the year. Safe access zones, which was another legislative issue that came at us in terms of wanting women to be able to access these services unimpeded, and health professionals. We passed the legislation in this House. The legislation will pass committee stage in the Dáil, I expect, potentially this evening. Sorry, in the Seanad, it's already passed the Dáil. In terms of the number of GPs, community providers, we've continued to see a small increase in the number of people providing that, I think, in an additional 20 providers over the course of the last 12 months, and that matters in terms of geographic access across our country. You're right that we did commission an independent review. We have received that independent review. The Oireachtas Health Committee considered it. It was sent back to the Department of Health, to the Minister for Health, in December. The bulk of the recommendations, as you acknowledge and also acknowledge are important, are in the operational space. And they've largely been put in place and are being embedded across the health service. And then there are some recommendations that aren't in the operational space, that are in the legislative space, and yes, they do fall to these houses to decide how to act. In relation to the three specific questions, these are issues that the government has not yet considered. But the Minister for Health will engage at the Cabinet Committee on Health on this shortly. I think they are issues, though, that deserve serious consideration. I must say, I think the way you framed them is quite responsible in terms of wanting to tease through some of the nuances in terms of how the draft legislation is operating. I think that's very different to some of the views presented in this House, which suggest that the draft legislation that we put before the people and said, if you vote yes, this is the law, shouldn't count for something. So I do take as constructive the points you're making around the 3-day wait period, around the issue of how a doctor feels in relation to the criminal justice system, and around the issue of, I think you used the phrase, clarification or clarity around fetal abnormalities. So the government will give consideration to the legislative proposals, but I also am struck, as the Health Minister, as you rightly say, I also do think in politics your word does matter, and I do think when you publish draft legislation, it does matter because when you publish draft legislation alongside a referendum and you say, if you vote yes, here's the law, that does also have to count for something. So I welcome the constructive way in which you've engaged on them. I'm not being coy in relation to those three matters, I'm being honest. The government has yet to consider them, but we do intend to discuss them at a Cabinet Committee on Health shortly.
Gerard?
Taoiseach, to hear that a year after the report was given to government that it hasn't been considered is extremely worrying. I heard the Health Minister yesterday say that we had to be cognisant of what people voted for in repeal as well, and in any plan to reform the law, and you referenced it there too. So I don't know if you're suggesting that you think the majority of people who voted for repeal wanted to continue to force women who need terminations for medical reasons to travel abroad. Because I have to say that I think the women, the very brave women who spoke out about needing a termination for medical reasons during the repeal referendum, won more hearts and minds and yes votes than your heads of bill. But for argument's sake, say that it is about the heads of bill, and you want to kind of honour that. In the heads of bill, it committed to having a review to see if there were any serious issues with the current legislation, and some very, very serious issues have arisen. The fact that people are still being forced abroad, the fact that women are being forced to wait 3 days to access medical care, something we don't see in any other kind of provision or care. It has no place in our law or in modern medicine, and it needs to go. So, on those three issues, do you think that they need to be changed? Can you outline to the House, when you're considering it, what position are you coming from? Do you understand why these things need to be changed, and why a year later that you're considering it now is far too long for the women who've been forced to travel, for the ongoing suffering? Every day women are still travelling.
Taoiseach, please.
Well, I too pay tribute to those who spoke out, and as you correctly say, I was very influenced and informed in my own views, and I'm also very conscious, as you say, that they played a much larger role than any politician in this House, most particularly myself, in bringing about a successful yes vote, because they spoke to the people of Ireland and the people of Ireland responded compassionately. But I also participated in debates, as did your party, as did your parties, where we did tell people that a yes vote was a vote for this and it wasn't for that. And I do think we have to reflect on that. Now, I think within that context, I think some of the things you've said have merit, because we did put in place a review clause, because we do want to make sure that the legislation is operating as intended. The perspective I come to from this is very straightforward. It's wanting to provide healthcare to women, wanting to be non-judgmental, wanting to be compassionate. It's the same approach I brought when I campaigned for repeal and when I worked across party lines in a minority government to pass the legislation. But it's not that the government has had a report and hasn't been doing anything. There's been a very significant amount of work done with that report, and we've in the operational space, and also from a legislative point of view, the priority has been in relation to safe access zones. But I will continue to keep you and the House informed on our thinking on this.